Did you know your body can start warning you about a stroke up to a month in advance? Yes, it whispers before it screams. Catching the signs early could save your life or someone you love. A stroke doesn't usually come out of nowhere. In many cases, your body gives subtle signals weeks before it strikes. Sadly, many people ignore or misread these signs until it's too late. But today, we're going to change that. Let's uncover 10 early warning signs of stroke that may appear up to a month before an actual attack. Number 1. Sudden fatigue or weakness. Have you ever felt overwhelmingly tired even after a full night's sleep? If simple tasks like brushing your hair, walking upstairs, or carrying groceries suddenly feel exhausting, it could be more than just being worn out. This kind of unexplained fatigue or muscle weakness, especially if it affects only one side of your body, might be an early warning sign of a stroke. Your brain could be struggling to send proper signals to your muscles due to reduced blood flow. If this feeling lingers or worsens, don't wait it out. Seek medical attention immediately. It could save your life. Number 2. Frequent dizziness or loss of balance. Do you often feel dizzy, lightheaded, or unsteady on your feet, like the ground is shifting beneath you? These sensations may seem harmless at first, but persistent dizziness or loss of balance can be an early red flag that your brain isn't getting the oxygen it needs. Strokes affect the areas of the brain that control movement and coordination. If you suddenly find yourself bumping into walls, struggling to walk straight, or feeling like you might faint, take it seriously. It's not just clumsiness. It might be your body signaling something far more dangerous. Don't ignore the signs. Act fast. Number 3. Vision problems. Have you been experiencing blurry or double vision lately, especially in just one eye? Don't chalk it up to tiredness or needing new glasses. Sudden changes in your vision can be one of the earliest and most overlooked signs of an upcoming stroke. Some people report brief periods of blindness or shadows in their field of vision that come and go. These visual disturbances happen because parts of your brain responsible for sight may not be getting enough blood flow. If your vision suddenly becomes foggy, distorted, or fades out, see a doctor immediately. It could be a silent warning. Number 4. Difficulty speaking or understanding speech. Imagine trying to say something and suddenly your words come out slurred, or worse, you can't find the right words at all. Or maybe you hear someone talking to you, but their words feel jumbled and hard to understand. These are serious early warning signs of a stroke, even if they disappear quickly. This happens when the part of the brain responsible for language is affected by poor circulation. Don't assume it's just stress or fatigue. If you or someone around you struggles to speak clearly or understand simple conversations, call for medical help right away. Time is critical. Number 5. Numbness or tingling. Ever feel a strange tingling or numbness creep across your face, arm, or leg, especially just on one side of your body? It might seem like you just slept wrong or pinched a nerve, but don't ignore it. Sudden numbness, or that pins and needles feeling, can be a major warning sign of a stroke. It means certain nerves aren't getting the signals they should, possibly because blood flow to the brain is blocked or reduced. If this sensation comes on suddenly, or gets worse over time, it's time to take action. Get medical help immediately. It could be life-saving. Number 6. Headaches that feel different. Not all headaches are created equal. If you suddenly get a headache that's unusually intense, sharp, or different from your usual tension or migraine headaches, pay attention. These thunderclap headaches can hit hard and fast, often described as the worst headache ever experienced. This could be your brain's way of sounding an alarm, a sign of a stroke or even bleeding in the brain. If your headache comes with dizziness, blurred vision, or trouble speaking, don't delay, call for emergency help. When it comes to your brain, waiting is risky. Better safe than sorry when something feels off. Number 7. Trouble walking or clumsiness. Have you recently found yourself stumbling, tripping, or feeling strangely uncoordinated? If your legs suddenly feel weak or you're dragging one foot, it could be more than simple clumsiness. Sudden difficulty walking or keeping balance might be an early warning sign of a stroke. Your brain may not be sending signals properly to your muscles due to interrupted blood flow. Even small changes in your stride or posture, like veering to one side, deserve immediate attention. If these symptoms appear out of nowhere, don't dismiss them. It could be your body's way of saying something serious is on the horizon. Number 8. High blood pressure spikes. Your blood pressure is one of the most important indicators of stroke risk. If you're experiencing frequent or sudden spikes in blood pressure, it could mean that a stroke is on its way. Elevated pressure can damage blood vessels, making them more prone to clotting or bursting, both major stroke causes. You might not feel the pressure rising until it's dangerously high, so if you notice symptoms like severe headaches, chest tightness, or nosebleeds, check your BP right away. When combined with other signs like dizziness or vision changes, high blood pressure becomes a flashing red warning light. Act quickly. Number 9. Mood swings or confusion. Feeling mentally foggy, easily irritated, or just not like yourself. These sudden changes in mood, personality, or mental clarity could be your brain signaling trouble. Strokes can affect areas that control emotions and thinking, often resulting in confusion, forgetfulness, or even depression days or weeks before the main event. If you find yourself forgetting things, struggling to concentrate, or feeling disoriented without a clear reason, don't brush it off as stress or aging. Cognitive changes are often overlooked but could be among the first red flags. Listening to your mind is just as important as listening to your body. Number 10. Facial drooping or muscle twitching. Have you noticed your face doesn't look quite right in the mirror? A slight droop in the mouth, uneven smile, drooping eyelid, or even small muscle twitches could be early signs of a stroke in progress. These changes might seem minor, but they indicate that nerves on one side of your face aren't working properly due to reduced blood supply to the brain. Try smiling or raising both eyebrows. If one side doesn't move like the other, seek emergency help immediately. Facial asymmetry is one of the clearest and most visible signs your body can give. Don't ignore it. Your body is smarter than you think. It often tries to warn you before disaster strikes. Recognizing these early signs of stroke can make all the difference. Don't wait. If you like this video, don't forget to like and subscribe to our channel.